Hi, welcome to the Slippery Slope. I'm Dr. Ziggy Opiates, and today we are going to talk about opiates and opportunity. And what I want you to realize is that the opiate issue in America is probably one of the biggest public health problems we've faced, at least in recent memory. It's a big problem because 27 million people in the United States are currently using illicit drugs and misusing prescription drugs. Over 66 million people, which is nearly a quarter of the adult and adolescent population, are binge drinkers. And alcohol and drug misuse and related disorders are a major public health challenge. Frankly, what's happening is a lot of Americans are self-medicating and they're using prescription drugs to do so. Plus, we have many people who have chronic pain. So we have to think about what are we going to do different. Well, I mentioned chronic pain. We've got 100 million people with chronic pain in this country, and part of that is the aging population. People who live in physical agony are usually expressing their pain in a lot of different ways, but they may be depressed, they may have mental health conditions. I work with pain patients on a regular basis, and I know many of them have been taking opiates for years. I'm talking like 10 years, and they want to get off of them. Opiate drugs can mitigate severe pain, but they cause addiction, and they can do some debilitating things. I had a patient, for instance, who had kidney failure because of the drugs that she was taking. So we are conscious of the fact that these drugs were oftentimes in the past given as a short-term medication at the end of a person's life to give them palliative care. Now we're using them long-term with people who have chronic conditions. So the most commonly abused opiates are fentanyl, codeine, morphine, but as you can see in this slide, heroin is out there, oxycodone, which is a very popular one. So there's a whole bunch of different derivatives of the opiate family, including some synthetics that have been made very popular by Big Pharma, which has really made a lot of money, by the way, selling these things to 100 million plus people. So where are we now? Well, the estimated annual economic impact of opiates is a $249 billion problem, with most of it being a result of alcohol abuse, and $193 billion as a result of illicit drug abuse. And so opiates fit into this very well with the illicit drug market. So if you can think about GDP and you think about healthcare costs and why they're up, well, here's a good reason for it. We're spending billions, not millions, billions of dollars dealing with not only the problem itself, but all of the conditions that go with it. More than 47,000 people died from drug overdose in 2014 in the United States, and nearly 30,000 of these deaths involved prescription drugs. And so we know that's a large number. Now, it's not as large as alcohol, which contributes to 88,000 deaths in the United States, but it's still a huge number. And so when we look at over 100,000 people dying because of substance abuse each year, we know that this is a huge epidemic. And I do want to mention that one population that has been hit really hard are veterans. Veterans are self-medicating, and they've been prescribed opiates oftentimes, and they're using them. And so the death rate amongst veterans, for instance, is much larger than it is among the general population, I'm sorry to say. The New Yorker put together a great video about how the opiate epidemic is affecting people in the Midwest, right down the road from us in Ohio. And I want you to watch this. It's a short video, and it'll give you a sense of how dramatically this is impacting the lives of average Americans right here in America on a regular basis. This is happening in America on a daily basis, and it's an unfortunate thing.
We got a call on the first day of my ride-alongs. It was on this very normal suburban street. When I had exited the car and walked up, I could hear agonizing crying from down the street. When I approached, I kind of came across this really incredibly heartbreaking scene of a family in mourning for their son who had just overdosed. It really was one of the harder photos I've ever taken. The family eventually reached out to me and invited me to the funeral. Felt really honored to be there. Everyone had a story to tell about personal addiction or knowing someone that's died from an overdose. It was incredibly emotional for everyone, especially Brian's older brother, Tim. They were two peas in a pod, thick as thieves. From what I understood, Tim and Brian used to use together, and I think Tim carried a burden of the responsibility for Brian's use. What's important to note about heroin is it completely eliminates pain, physical pain and emotional pain, and I think people that are prone to depression and traumatic events in their lives, that is an obvious place to turn to. When researching for the story, I had heard about a coroner's office in the city of Dayton. And the coroner there had basically been running out of room for bodies that were coming into the coroner's office. The morgue was at capacity with opioid-related overdoses. He was speaking very candidly about it. The more and more I researched, I realized that this county, Montgomery County in Ohio, had the highest overdose rate in the country per capita. That, to me at least, seemed like the place to go. We were on nonstop ride-alongs. Would do 2 shifts, some days only taking opioid calls. One of the more memorable calls was actually my last day. We got a call for an overdose in North Dayton. Young man must have been in his early 20s. It was almost like he was snoring, but his eyes were more or less kind of rolled back in his head. Just watched Dayton City Fire administer Narcan hit after Narcan hit. His mother was in the room, which was rare. I'd never really kind of seen family be allowed to be in the room when, first responders are working on someone like that. And she was really stoic. I was really surprised. It was almost like she'd seen that before. One of the firefighters mentioned, we're close to our record, which is 14 hits. I guess their personal record within that fire department was 14 hits of Narcan in order to revive someone that's overdosing. By hit 11, he finally came to. Narcan is this really unbelievable miracle drug. It's not unlike a nasal spray. When someone is overdosing on an opiate, your breath slows to a halt. If the first responders can get to you before you fully flatline, you'll be administered Narcan, and that will reverse the effects of the overdose. One thing you need to understand with the first responders is there will be times when they're administering Narcan in the morning, that person will recover, and those same officers will be responding to another call in the evening for the same person overdosing. I think there's a real wall that they need to keep up in order to maintain this sort of matter-of-fact process in order for them to do their jobs efficiently. All the officers I rode with knew everybody by first name, knew their parents, knew their sisters. That was something I didn't expect. I don't think law enforcement have a collective hypothesis as to why this is happening. And it'll really depend on who you're speaking to. If you're speaking to a deputy or a police officer who's kind of dealing with it at a street level, they would attribute it to generations of heroin users. Other officers and other people within law enforcement will hypothesize that it had a lot to do with doctors writing prescriptions for pain meds. What we're starting to see now with fentanyl and carfentanil is a far more concentrated form of heroin. It's a synthetic opiate that has hit the market, and this is advantageous for drug traffickers because it's far more condensed, it's far more powerful. They can sell a lot more of it. We all, at some point, have to have our wisdom teeth removed or go into surgery. Heroin and opioids, they're an extremely powerful and extremely addictive drug that latches hold of you. The needle doesn't discriminate. It could really be any of us, you know, it could really be any of us.
It's very sobering, and it really brings you into that world. My years of working with heroin addicts, substance abusers, really gave me a real appreciation for how desperate, how dark, how involved the lives are of people who use substances. But there is an opportunity here, and we've learned a lot over the years. Ongoing health care and criminal justice reform could make it easier for us to start helping these people. There's advances in clinical research. There's new information technologies that are giving us effective prevention techniques, population health models that can help in this matter. We can actually do something about this. It's not something that we have to watch happen. But here's the problem. Only about 10% of the people with substance use disorders receive any kind of specialty treatment. And besides that, 40% of the people with a substance use disorder also have a mental health condition, so they have a dual diagnosis. And the other thing that's going on is that about 40% of the population's not ready to stop using the substances. And so they're hard to work with. And some people are simply not able to really problem solve or make good decisions, because one of the things that happens as a result of using substances is people are profoundly affected in their judgment, in their motivation, in their priorities, and so they don't make good decisions. And if left to that, they'll eventually just end up dying or causing death for somebody else. It's a downward spiral, and we have to throw them a lifeline. We have to bring them out of that downward spiral. And this is a national emergency. Now, the research on alcohol and drug use has told us that this is a treatable brain disease. It requires medical intervention. It's not something for moral judgment. And the people who want to cast moral judgment on these people probably should realize that within their family, they probably have somebody who's a substance abuser. So, you know, when you think about moral equivalency here, it's very easy to castigate against a veteran who's living on the street, or maybe a poor person living in a urban area where there's very little opportunity. But when your own son or daughter is affected, you start to think about these things differently. The policies and programs have to be developed that help us to prevent alcohol and drug misuse. And we have to use effective treatments. And a combination of medication and behavioral therapies can lead to outcomes. But we have to invest in this too. And we have to look at these people as salvageable, not as something to throw away. And I think that's a very big decision for many people. We have to support services and particularly groups that are out there. I went to an Alcoholics Anonymous open meeting with my wife just a couple weeks ago. And there was a person there who told us about her road to recovery. The room was full of people who had gone through similar things. We need to support groups like that. We need to respect what they're trying to do. We also have to understand that healthcare reform that just took place finally made it possible for insurance companies to pay for substance abuse treatment. So as much as you might like or dislike the Affordable Care Act, it actually created situations where payment for this treatment is possible. But we also have to engage the criminal justice system. We have to place nonviolent drug offenders into treatment. And we have to improve the delivery of care for those people who are incarcerated and who are also substance abusers. And we have to have community follow-up programs so that when they leave jail, there is somebody to pick them up and to work with them so they don't go back into using substances. Because remember, this is self-medication. People who don't feel good about what's going on are going to reach back and try to find the things that they found in the past that worked for them. So by adopting evidence-based public health approaches and by reducing the collateral damage, we can do a lot for our communities, we can do a lot for our families. Making these changes are going to require a cultural shift, though. We have to walk away from looking at this from a moral standpoint and look at this as we would any other illness that we have treated in the past, like diabetes, for instance. By coming together as a society, we can resolve these problems. We need to change attitudes. We need to become much more positive. And that's something that we can all do. So I want you to work with me. I want you to think about what we can do together to take care of this problem. And keep in mind something very important. In your lifetime, in my lifetime, we're going to come across somebody who needs our help, a substance abuser. Reach out to them. Do something for them. Work with them. You know, they need it more than you probably realize. Be there for them. And together we can make something happen. Thank you. And remember, when you and I work together for the good of our community, we all benefit.